parents! Check this out. This team of scientists followed kids for 8 years to figure out what really messes with their mental health in the long run and what small daily habits actually protect them. If your child spends hours glued to a screen or resists every chance to move unless it's for a snack, stick around, because what they discovered could change how you think about screen time and give you research-backed ways to support your child's mental well-being. This massive study came out of Finland, led by Dr. Eero Haapala and a team of researchers across Europe and Australia. They followed nearly 1,000 kids from age 6 over 10 years, until they turned 16, tracking their lifestyle habits, activity levels, eating patterns, and screen use. This wasn't guesswork. It was hard data. Kids wore chest sensors, like undercover fitness trackers, to measure movement, heart rate, and sleep. Parents logged every bite their kids ate for 4 straight days. And screen time? It was broken down by phones, TVs, and computers, so they could see exactly what mattered. Then, at age 16, the same kids took mental health checkups, looking at stress levels and symptoms of depression. Here's what they found. Every extra hour of daily screen time in childhood raised the risk of teen stress and low mood. And mobile phones were the biggest red flag. Heavy phone users scored considerably higher for depression and were noticeably more stressed than their peers. But here's what helped. Kids who were active, especially in sports or dance led by a coach, had 15% lower scores for stress and depression. And the most powerful combo, low screen time and high movement. Those teens had the best mental health of the entire group. The worst combo, kids who moved the least and used screens the most, they had the highest depression and stress levels across the board. And surprisingly, sleep and diet didn't predict mood in this study. It was all about movement and screen use. So, if you're trying to support your child's mental health, here's what the experts recommend. 1. Limit total screen time, especially phones. Stick to under 2 hours a day for phones and under 4 hours total for all screens. That's when risk started to rise. 2. Enroll in coached activities, whether it's soccer, swimming, dance, or PE clubs. Regular exercise led by a coach made the biggest impact on kids' mental well-being. 3. Swap scrolls for play. Just 30 minutes of movement instead of phone time made a meaningful difference. 4. Try a screen swap challenge. Make it a game. For every social media break, earn 20 minutes of outdoor play. Keep score as a family. 5th, track it over time. Use a calendar, notebook, or screen time app to catch small habits before they become long-term stress triggers. 6. Don't forget sleep and food. They weren't the top predictors here, but they still support energy, focus, and motivation to stay active. Because when it comes to kids' mental health, it's not just what happens in high school, it's built during childhood, through everyday habits like sports, screens, and how often they move. If you want more alternatives to screen time, or you're wondering how to keep your child off devices and engaged in healthy routines, this research is your roadmap. To read the full study, check the link in the description below. And if you want more research-backed tools to raise stronger, happier kids, subscribe to this channel, because we break down what really works, one study at a time.